This presentation was prepared by and is presented by Georgina George, MSCOT student, Department of Occupational Therapy at the University of Alberta. In this presentation, we will gain a better understanding of psychological health and safety in the workplace. We will discuss factors impacting psychological health, explore indicators of psychological health and safety, and gain an understanding of current initiatives in Alberta and Canada. What is psychological health in the workplace? When we think of health and safety in the workplace, we often think ergonomics, fall prevention, and protection from injury. As an OT or other healthcare professional, we often learn about the importance of proper positioning during lifts and transfers and caution around needles and body fluids. However, psychological health and safety is not to be confused with physical safety. Confused? Stay with me. Let's find out what psychological health and safety in the workplace is. In order to arrive at a working definition of psychological health and safety, let's take a look at some definition. The World Health Organization defines psychological health, which is equivalent to mental health, as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Psychological safety, on the other hand, is defined as the absence of harm or threat of harm to mental well-being that a worker might experience. Together, these elements create the definition of a psychologically healthy and safe workplace. As is discussed in the CSA group, which we will look at in further slides, there is an implementation guide in which the definition states that a psychologically healthy and safe workplace is a place that promotes workers' psychological well-being and actively works to prevent harm to worker psychological health, including in negligent, reckless, or intentional ways. Let's take a look at psychosocial factors that affect psychological health and safety. Psychosocial factors are elements that impact employees' psychological responses to work and work conditions, potentially causing psychological health problems. These factors can be grouped into two main categories to include the how, that is, the way work is carried out, which includes deadlines, workload, and work methods, and the context in which work occurs, which relates to relationships and interactions with managers, supervisors, colleagues, and co-workers. Now, Canada has been a leader in developing psychosocial well-being in the workplace and in raising awareness in reducing health and safety risk. In 2013, the voluntary standards was developed by the Mental Health Commission of Canada and Canadian Standards Association Group, also known as the CSA Group. Psychological health safety in the workplace, which is the Canadian standard, is a management system that can help an organization identify hazards that can contribute to the psychological harm of the worker. Another organization was the Canadian Healthcare Association, also known as a CHA, and also the Great West Life Center for Mental Health in the Workplace, which is an insurance company. It designed a website called Guiding Minds at Work, which is an evidence-based, comprehensive set of resources designed to assess psychological health in the workplace. A psychological health and safety management system gives organizations a customized and sustainable framework for prevention of harm, the promotion of health, and the resolution of incidents of concern and continuous improvement. Now let's look at the 13 psychosocial factors as is described by the Guiding Minds website. There is psychological support, organizational culture, clear leadership and expectations, civility and respect, psychological competence and requirements, growth and development, There's involvement and influence, workload management, engagement, balance, psychological protection, and protection of physical safety. What are some indicators of psychological health and safety? For one, there's an increased disability claims based on depression or stress. The failure to adequately address psychosocial hazards at work is apparent in this escalation. Two, there's also the increased reports of workplace conflict. There is also decreased levels of job satisfaction, health, and commitment. These in turn contribute to reduced performance, higher turnover, increased cost, and compromised safety. If these are not dealt with appropriately, the net result may well be a loss of customers, productivity, and valued employees. On the other hand, proper awareness and attention to ensuring the psychological health of workers and the workforce will enhance employee engagement and well-being and organizational effectiveness and sustainability. Why do we need to promote psychological health and safety in the workplace? There are a few advantages, such as there will be a decrease in job stress, which in turn will lead to improved productivity. It will cut down on the absences of the employees. It will increase worker retention. And finally, it's one way of enabling early return to work. Hope you enjoyed this presentation and thank you so very much for listening.